So it's a all-in-one product because we're using only one electrode. It's an all-in-one product because we're combining two different currents, and it's an all-in-one product because we can have different effects. We can have an effect on the pain management. We can have an effect on the trophicity. That means we are restoring the good condition for the tissues. And we can also work on the fibrosis, on the adhesions on the tissue. So that's why it's a very wide open technology, because we can treat from the acute phase to the chronic phase. That's why it's also something which is really important to explain, that we are really wide open. It's not only something which is comparable to the shockwave. Okay, we can treat some shockwave indications, but we, compared to the shockwave, we can also treat the acute pathologies, which is something new, because with the shockwave we are really limited. Right here we are opening the pathologies. Also, why it's all-in-one, it's because we're using this specific electrode. This specific electrode allows you to work in capacitive like, so it will be comparing to the capacitive effect. Capacitive effect are mostly the vascularization, the relaxation, okay? The resistive effect, most of the time when we're speaking about resistive effect, it's because we're fighting against fibrosis, against the adhesions. And the last one is the pain management, because we can use the pulse electrostimulation, which is bombarding the receptors. So you see, that's why we are really open with only one tool, one electrode. So that's why we decided to change on not speak about Tecartherapy. It's not a Tecartherapy. We're combining all in one. We are combining different currents. So that's why you have to see it's really like a fractal therapy.